Can a PFO be a hidden cause of stroke? Imagine a tiny hole in your heart that most people never even know they have. That's what a patent foramen ovale, or PFO, is. It's a small opening between the upper chambers of the heart that usually closes after birth. But in about 20 to 25% of people, this hole stays open. Most of these individuals never have any symptoms or health issues. However, in some cases, this small opening can be a hidden cause of stroke, especially when doctors can't find an obvious reason for the event. To understand how a PFO might cause a stroke, think about how blood flows through the heart. Normally, blood from the body enters the right side of the heart, then goes to the lungs to pick up oxygen, and finally moves to the left side of the heart to be pumped out to the rest of the body. If a small blood clot forms in the veins, often in the legs, it usually gets caught in the lungs and is broken down. But if someone has a PFO, that clot can sometimes pass directly from the right to the left side of the heart, bypassing the lungs. From there, it can travel to the brain and cause a stroke. This process is especially considered in cases of cryptogenic stroke, which means a stroke with no clear cause. About 1/3 of all strokes are classified as cryptogenic. In these situations, a PFO might be the hidden culprit. The link between PFO and stroke is stronger in younger patients, but it can also be relevant in older adults. It's important to remember that most people with a PFO will never have a stroke related to it. Having a PFO is quite common, but only a small number of people with it will experience a stroke because of it. When a stroke occurs and doctors cannot find another cause, they often look for a PFO using specialized imaging tests. One of the most detailed tests is a transesophageal echocardiogram, or T. This test involves inserting a small probe into the esophagus to get a clear view of the heart structure. Finding a PFO during this test can help explain why the stroke happened and guide treatment options. Treatment depends on the individual. For some, medications like antiplatelet drugs or blood thinners are used to prevent future clots. In other cases, a procedure might be recommended to close the PFO. This involves inserting a tiny device through a catheter to seal the hole. Studies have shown that closing a PFO can lower the risk of another stroke, especially in patients with certain high-risk features like a large PFO or an associated atrial septal aneurysm. But not everyone with a PFO needs this procedure. The decision is made based on the person's overall risk, age, and other health factors. It's also important to understand that a PFO can be an innocent bystander. Many people with a PFO who have a stroke may have other contributing factors. Not all recurrent strokes in people with a PFO are necessarily caused by the hole itself. That's why a thorough medical evaluation is essential to identify all possible causes of stroke and to tailor the best treatment plan. In summary, a PFO can be a hidden cause of stroke, especially when no other explanation is found. Detecting it involves specialized heart imaging, and treatment options include medications or a procedure to close the hole. But having a PFO does not mean a stroke is inevitable. Most people with a PFO will never experience a stroke related to it. If you are concerned about stroke risk or have had an unexplained stroke, it's important to consult a healthcare professional for personalized advice and evaluation.